Well, if you have silver-colored fillings in your teeth, should you have them replaced? That question comes up because of some controversy right now over the fact that silver-colored fillings contain mercury. 6 News health specialist Lori Tucker is covering medicine for us tonight. She joins us live in the studio.
Well, several health advocacy groups like Consumers for Dental Choice claim the mercury in silver fillings can cause everything from kidney problems to brain damage. And while other more mainstream medical groups say amalgams are fine, we checked with a local dentist to see what he's doing about the controversy. Dr. Pablo Foncea hasn't used amalgam fillings in his patients for more than 10 years. He thinks for the most part they are safe, but not for everyone.
I think that there's probably a few people that are sensitive to those.
Plus, he likes the alternative to amalgam fillings a lot more. This is composite resin. It looks more natural, doesn't contain mercury, and is easier, Dr. Foncea says, on your teeth.
I can actually be more conservative with the tooth preparation, meaning I can leave more healthy tooth structure there by using a smaller filling, which is allowable with this new material, the composite resins.
The American Dental Association insists amalgams, which have been around for 100 years, are safe, and the Food and Drug Administration goes back and forth. In 2008, it suggested pregnant women and children avoid them, and 1 year later said they're fine. Just look inside Melanie Van Tilburg's mouth. All you see are shiny white teeth. She's had most of her silver fillings removed and replaced with composite resin, but not out of fear for her health.
I got tired of seeing myself in pictures with my mouth where I was laughing, and I had these dark spots in the back and I got tired of that. I didn't know the risk, and then after I started doing, a section at a time, everybody was like, oh, it's good you're getting rid of those because that mercury is dangerous.
Again, Dr. Foncea doesn't believe amalgam fillings are dangerous for most people, and if a dentist tries to talk you into replacing all of yours, he says be cautious.
All right, Lori joins us live in the studio to answer more questions about this. So, Lori, let's get to the cost of all of this. What are the costs associated with replacing these?
Well, if you're talking about composite resin fillings, they are a lot more expensive than amalgams. Most dental insurance companies won't pay for composite resin. So if you opt to have that, you may have to pay a percentage or more out of pocket. It just depends on which insurance company you have.
And a lot of people probably didn't realize that. Let's talk about the FDA for a minute. You said in your report that they keep going back and forth on their opinion on this. What is the latest?
They really do. They get so much pressure from these what mainstream medical associations call fringe groups. The FDA's most recent hearings on the safety of amalgams wrapped up earlier this month, and what it's done at this point, it's agreed to simply hold more hearings on the use and safety, but so far no big changes from the FDA have been made regarding these.
All right, thanks, Lori. In other medical news tonight,